everybody.
Thank you.
Thank you, all of you, for doing this meeting. And things were kind of up and down, and we were hoping Lisa Ferre would be here, but she can't. Anyway, so what I'd like to do is do some brief introductions, who we are, why this topic is important to us, and go from there. So I will start. My name is Cathy Blake, and I am the Healthcare Action Team leader for Arvadans for Progressive Action, which is a progressive group. We do advocacy and we have general meetings and once a month. And then I have a Healthcare Action Team meeting once a month too. And then the other thing is I got interested in healthcare. I was stopped at a traffic light in 1998, and a small truck hit my car doing 40 miles an hour. And I was dazed, disoriented, went to the hospital. I did not sleep there, but I did end up with a traumatic brain injury. And yeah, so, and then I had to deal with trying to get rehab. And fortunately, at the time, I had a large kind of med pay, is what they call it now. So I was able to, get some good. Although my mother did have to help me. She was a lawyer, to advocate for vision therapy, which my insurance company kind of at the end of the process was not going to pay for it. So that, yeah, I think we got that. All right, so who would like to go next?
Okay, I'll go next. I'm Pat Malone, and I am part of the action team meeting with Arvadans for Progressive Action, and have been with the healthcare team for, I don't even know, about 5 years maybe, of the 8 years we've been in existence. And I don't have a personal story. I'm on Medicare. That's a whole nother nightmare. The Medicare Advantage versus original Medicare, and that everybody should know about, whether they're 40 or 80. Anyway, I just think it's outrageous that this country that thinks that they are the best in the world and thinks we have fantastic healthcare coverage, that it is so unequal. And that, my sister thinks that hers is great. A friend thinks theirs is great. Somebody else thinks theirs sucks. I mean, we're all Americans. Anyway, so I just think it's an outrage, and that's why I am involved in it. Well, thank you for being here, Amy and Dr. Lee.
Yeah, I can go next.
Virginia and Joyce.
My name is Lee Thompson. I'm a licensed clinical psychologist. I am also the co-chair of the Colorado Foundation for Universal Healthcare. I don't necessarily have a personal story myself, but working with my clients in the mental health system and not always having access to care because of how insurance are barriers, especially things like Medicare Advantage programs. I've had to have a lot of conversations with people about that more recently than not, of like, please don't change your insurance to that, because you'll not only have less access, but you'll also lose me as a provider, since I'm not covered under those plans all the time either, despite being a Medicare provider, and how limited for mental health for Medicare clients, you have to be a psychologist or a LCSW, which eliminates tons of LPC and different master's levels of therapy providers around. So I'm just always really interested in about universal healthcare. Growing up in a military system all over the world, so I've seen what healthcare looks like in different spaces. I'm currently someone who is on a cost share plan for insurance because I am lucky to be relatively healthy, and the premiums are just way too expensive as a single self-employed person for insurance. And it's cheaper for me to have a cost share plan and pay out of pocket what I need to go to the hospital. And that's been jarring to see, even sometimes where I've seen my previous healthcare and what the insurance like covers for like a breast MRI, and then I go get mine at the end of the year out of pocket, and they tell me it's 284, but if you could pay all at once, it's only 184. When I've seen them charge like 1,000 plus for that same service, it doesn't even make sense. And even on my end, I feel I hate being that I take some insurances and that I have to tell insurance companies that they need to pay me more so they could justify paying me even close, not even close to what my actual rate is, because otherwise they just devalue what mental health looks like in the healthcare system. So that's a really big part of my fight.
I hear you. Thank you, Dr. Lee. I also am, I'm a licensed professional counselor in a small private practice. And so I get it. Who would like to go next?
I'm happy to go next. Coming into this just yesterday, Rep-elect Foray keyed me in on this situation. We were both up at a training yesterday. So I am Rep-elect Amy Paschal. I'm from House District 18, which is in Colorado Springs, Manitou Springs, Cascade, and Green Mountain Falls. I am very interested in the whole universal healthcare topic. It's actually what got me into politics in the first place. I do have a story. Well, my background, I'm a software engineer, and I was a stay-at-home mom for several years. And one day, my husband and I were out walking our dogs, and we got hit by a car, hit and run. My husband was in the hospital for a month. I was in the hospital for 2 weeks. And we, both still have, we lived, which actually is a miracle because most people that get hit by a car don't live. We're both upright and walking, which is also a miracle. But we both have lingering issues. We both had traumatic brain injuries. I have 4 fake teeth in the front. I got thrown across the street and did some body surfing on my face. So I have broke my face in a couple places. I have a lot of scars and anyway. But so the good news is we all survived, including the dogs. And we're all basically functional. My husband got optical nerve damage with his brain injury. And so he is, this was 10 years ago. So he still has double vision, and that's probably for life. He went through many pairs of glasses, very expensive glasses, to try to do therapy on it, did some physical therapy on it. There's potentially some surgery he can do, but it is the gift that keeps on giving. And as we went through this whole process, and I'll give you the streamlined version because it's complicated, but there's all kinds of different insurances that come into play. Healthcare insurance, obviously. Car insurance came into play, even though we weren't in a car. Since it was hit and run, it came under uninsured bodily injury for us. We did have to fight. Did have to get a lawyer. We did have to fight the car insurance paid out, and they started paying out the hospital, and because apparently Kaiser didn't pay them enough. And so that's why we had to go down the road of making sure that we actually got paid for taking care of the injuries that fall between the cracks. So for me, that was dental, and for my husband, that was vision. We had significant expenses beyond the caps, and we were both full-time employed software engineers working for another company, not for ourselves. And we went through all kinds of issues with insurance, even though we had all the right insurances. We had good insurance. So going through that whole process, I had been really out of the whole political world for a long time, busy doing my career in software industry, raising my kids, and it occurred to me, this is just messed up beyond what I even imagined it was. We also, fun fact, we got thrown off of our healthcare insurance during this too, which was a whole complicated issue. And we ended up, because it happened we ended up going on to COBRA for a while and then getting back on our insurance. And since this happened in November, we went through crossed 3 different plans and paid our deductible every 3 different times in the course of like 5 months. So it was a whole thing. And so, the next caucus was 2016, and Bernie Sanders was talking about universal health care. And I was like, this is messed up. So I went to caucus for the first time, previously been afraid to show up, that someone would, I don't know, yell at me or talk me into something. And so that, as they say, was the beginning. I did get talked into stuff. I became an election judge, and I have done that ever since, and been on the canvas board in the elections department here in El Paso County. And I became a precinct organizer for the El Paso County Democratic Party. And I have held positions, all kinds of different positions within that organization over the past 10 years, including being vice chair for 3 years. No longer holding positions there because I ran for office, and going to start my first term in January. But the whole healthcare thing is very near and dear to my heart. I feel like we pay for our health care in the most inefficient way possible, in the most expensive way possible. And we claim as a country that we can't do it any other way, but obviously other countries do. So that's malarkey. So I would love to see our country ultimately go to universal health care. I know that's a very far, goal at a long end of a path, and I'm not sure how we're going to get there. And I'll take whatever I can on the way. But that's me. That's my story.
Wow.
Thank you for sharing. That's quite,
Mm.
yeah, quite a story. FYI, I was a computer programmer analyst before before I got hit, and I just couldn't do that work anymore.
I was lucky enough that despite we both had traumatic brain injuries, and of course, our number one fear, our kids were in a freshman in high school and 8th grader at the time. And of course, we were terrified that we were not going to be able to take care of ourselves and we were very lucky. We both have permanent brain damage, but we're functional enough, and we were employed, and we went back to work, and my husband still works there. And I've switched careers and got into political stuff. I worked for the Colorado Democratic Party and elections department and all kinds of different things. But yeah, we were still able to do that, and we were very, very lucky.
Well, it sounds like you were giving a lot back to the community as far as trying to get a better situation for the next person that gets, hit by a car. Or,
Trying to, as you all know, I'm sure it's harder than you might think.
Yeah, yeah. But we are all here, and we're all, what is it? Soldiers or something, or compatriots, or whatever. Okay. Joyce, do you want to tell them a little bit about yourself, or?
Sure. I'm with Arvadans for Progressive Action as well, and have been on this committee for a lot of years. And I'm involved, as Virginia says, I have reached the holy grail of Medicare, so I'm okay, but my millennials are not. I have one daughter who has a great job and actually very good insurance in Illinois. My son, not so much. He lives up in Gunnison. Healthcare is barely there anyway, and he's under the ACA, and they have insurance basically in name only. The deductible is so high that they don't go to the doctor whether they need to or not. And that's what I'm fighting for, is universal health care that takes care of everybody, not just me.
Thank you, Joyce.
I could go next. I'm Virginia Gebhart. I live in Lafayette. I'm a retired pharmacist, and I've been involved in the movement since 2016, off and on. I've been involved in Boulder County Democratic politics too, as a precinct organizer and so forth. In fact, the reason I stay involved is to ensure that the party platform reflects a very strong statement of support for universal health care. And I'm also the president of Longmont Area Democrats, which is a club, not the official party. And the reason I got involved with them was they let me come to their farmers market booth and talk about universal health care. And so I'm still talking about it. And, as a pharmacist, I've seen things go from bad to worse in terms of health insurance. I got my license in 1975, and back in the day, pharmacy practice was reasonable. I mean, you had to deal with insurance companies and so forth, but they actually covered things. And I guess one example of how terrible things have gotten and how much they've changed, I mean, they've gotten terrible in all kinds of ways. But I think the prior authorizations that are just really egregious these days. I mean, there was no such thing as a prior authorization back in the day. In pharmacy, the prior authorization was the prescription that the doctor wrote. And all of these barriers that have been put up by for-profit insurance companies and PBMs it's just unconscionable. And frankly, the complexity and high cost of corporate run insurance is killing us. And we've got to try to do better. And that's what our bill is all about, which I hope we'll talk about, is trying to do better. And as Amy said, that, we've just got to do something. And of course, Bernie talked about Medicare for all at the federal level. And I know my millennial sons just think that's a marvelous idea and are just like, what the hell? Why don't we have that already? And I used to think that trying to get universal health care state-based in Colorado was just too hard. It's really hard to do, and it's just too hard. But the alternative is waiting for the federal government to give us Medicare for all. And I've come to the conclusion long before this previous election that the federal government is so corrupt that they will never do it. And I just mean, not only the big money in politics, but the industry has captured the regulatory agencies. And so, there's just a revolving door between the agencies and the industry, and everybody's, scratching everybody else's back. And I just don't see it happening at the federal level. So we in the states have to work on it, and there are several states working on it as well as us. And somebody will be successful, and somebody will lead the way, and do it right. And everybody will look around and say, "Well, I want that too." And so I think that's our pathway.
Yeah, that's how Saskatchewan was the first province in Canada to go to a universal single payer system, and then everybody else was like, yeah, this is working so much better and saving us money, and we need to go there. Okay, so I'm just wondering if we want to do talk about the bill. Amy, have you had a chance to look it over, or
I haven't. So I would love that. I am apologize that I am pretty ignorant about what's going on here. So whatever you can tell me, I would appreciate.
Okay. Well, I'm going to start with a real general overview and then kind of go to, kind of more specific things about the bill. Okay, so first, single payer. Do you have I can give you an overview of what that looks like in very general terms, and then we can get into the bill. That's kind of what I was thinking. Is that going to work for you? Okay.
Yeah, sure.
this came from a little video from the state of Oregon. Okay, so you would, so their summary, basically, there would be no healthcare bills, no conflicting plans or networks or complicated things to consider. There'd be one quality plan for all of us for our whole lives. We'd be free to have the job we want, not just ones that provide insurance. And I know a number of people that are in that situation. We'll be free to see our own doctors and mental health. Would be another part of that. Receive the best care for our families when we need it, not just when we can afford it. So healthcare would be not for profit here. We're taking, it's not a commodity, it's a public good. Okay, so then people would not have to put off seeing the doctor and getting sicker because they can't afford it. And as we know, preventative care is a lot cheaper than extreme care, which is, people wait until well, I'm thinking of a gentleman who his wife had like chest pains, but she didn't want to go to the doctor, and 3 days later she died because she didn't get there in time. Okay, be free to have the care that our doctors would advise without worrying how we're going to pay for it. Okay, and we'd be free from financial worry, which would help also our recovery from whatever problem we have. So that's kind of a brief overview. And so for Colorado, just a little bit about history there. Let's see. Voters, let's see. The study was conducted in 2020 for looking at 3 different multi-payer system completely, and then the one we have right now, which is kind of half, and then a single payer system where we would all pay in, everybody in the state would pay into the system based on their ability to pay, and then would get their health care. Everybody would have like a comprehensive, including vision, dental, hearing. So a study was conducted in 2020, and this was more of an overview, not a really detailed study, but the healthcare cost savings report published the findings in 2021 that a single payer option covers everyone at the lowest cost, saves about $3 billion. And that's House Bill 1176 was the study. And there was no action taken on that particular result.
What year was that? You said 21?
That's when the savings cost came, or the study results came out. But the House Bill was House Bill 19-1176.
Okay, thanks.
So that was kind of the big picture of things in Colorado. And then Virginia, maybe you can tell them about the 2016, because I wasn't as involved in that, where we were trying to get a ballot measure to pass, and it didn't. Go ahead.
Sure. In 2016, there was a citizens initiative to create a single-payer universal healthcare system for Colorado, and it was on the ballot, and the vote was 21% in favor, and so obviously it didn't pass, and so it was time to regroup and keep on working on this, and that's when I got involved with the movement with the Colorado Foundation for Universal Health Care. And so eventually what we were able to do is to get this 1911-76 Healthcare Cost Savings Act passed, and the Colorado School of Public Health did the analysis that Cathy was just talking about, which showed that single payer would save money and improve health outcomes and cover everybody. And so we in the movement, including Colorado Foundation for Universal Healthcare and others, thought that, well, with these results, somebody in the legislature will take up an effort to take the next step and run a single payer bill again. And we got crickets, no reaction until Representative Basenecker in Fort Collins was persuaded by one of his constituents to take up the bill or to take up the cause. And he reached out to Representative McCormick in Longmont, who I know, and they agreed that it would be a wonderful thing to try again to get single payer in Colorado. And they kind of shopped it around to the folks in the legislature to see, would you support this? And the overwhelming response was, we don't have enough information to support this. This isn't detailed enough. We need to know more about what this would look like. And so that's what we're working on now. And we tried it in 2023 session, 2024, and died on the calendar. And so we're going to run it again. And we think we have, a strategy that'll work this time, and leadership in the Senate has changed. So we're hopeful that it will pass. And the way I would describe this is the 1176 report that came out and that was reported to the legislature in 2021 was like a foundation. Like if you're building a house, if I can use that metaphor, that laid the foundation so that you could see the outlines of what the house is going to, might look like and so forth. But you can't see what the house is going to look like. If we're building a house, you don't really see it until you frame it and do all the other detail work. And so I would say, I would compare what we want to do with this new bill is to frame the house so that people have more details and can see, oh yeah, this is a house I might like. This is a house I could buy. This is a house that would fit my needs. And just fill in the information of all the many, many, many questions that people have about what single payer would look like for Colorado. So that is kind of what we're up to. And we believe that we'll be successful this time. As you know, sometimes it takes several tries to get big legislation passed. And so,
So
do you
what
have any
is
questions?
Yeah, so I realized the bill that you sent me, Cathy, is from last year, and I am somewhat familiar with this one. So who are the sponsors for this year's bill, and what are they going to do differently?
The prime sponsors are the same as 2024, which was Representative Basenecker and Representative McCormick, and they started it in the House. And the prime sponsors in the Senate are Senator Hawkes Lewis and Senator Marchman. And our roadblock came in the Senate. And so this time we're going to start that bill in the Senate and get it through so that it can't die on the calendar like it did the last two times. And the other piece that's way different is, and we understand is quite important this year, is that we're planning to fundraise the fiscal note because we understand, the budget is extremely difficult this year and that there will be just very, very little, if anything, available for discretionary spending. And our fiscal note last year was, it started out at like 450,000. But even then, that was too much for last year. And so Representative McCormick did a lot of work to split it into 2 fiscal years to get it down under 200,000. And she also got a grant to use some software too for about 50,000. So she spent a lot of time on that, and we just won't have to do that this year. Plus, we understand that if we're funding the fiscal note, that it won't get hung up in appropriations, as can happen so many times. And so that is some of what we're doing that's different. And our Senate prime sponsors have said that they have done a lot of work in the interim to make sure that the Democratic senators will be supporting this bill, including the new presidents of the Senate, James Coleman. So, and the previous president of the Senate was not our friend. So, we feel like we're set up for success because of some of those changes.
All right, very good.
Yeah, we have a committee that's working on fundraising, and they are working with a professional fundraising person. And so, that's how we're going to get our study paid for. And the School of Public Health has, like Virginia was saying, has like a basis built, and now going to, add the different pieces to it and make it so that we can answer questions like, how is it going to affect my Medicare? Or, what's it going to do for para? Which, so there's questions that, when I was talking to people about that, they asked me these questions too. And,
Sure.
We really need to be able to answer. Well, this is because people don't like, would be a big change, and people are, haven't experienced it before, and they're,
Change is scary.
yeah, it's scary.
It get worse, right? So don't want it to get worse.
Exactly.
Right.
And I would add that the folks at the Colorado School of Public Health are anxious, very anxious to do this work, because in that first study that they did, they built a microsimulation modeling so that they're able to plug in different factors to determine how that would affect the costs and so forth, and affect, it's just all very complex, and they spend a lot of time and building that model. And we've asked them this time to include long-term supports and services. And they had said in previous bills that the data for that just doesn't exist like it does for everything else. And so it would be extremely difficult to model as in much detail. But we asked them to go ahead and do that. And so that does increase the fiscal note. It actually doubles it, because they have to build a whole nother microsimulation modeling for that information. But we feel it's really worth it, because folks in the disability community are really, they have good insurance now through Medicaid and Medicare. They have good insurance, and they would be really afraid of losing it if we don't include long-term supports and services in our analysis. So I feel that's, it's a political issue in terms of whether they would support us or not, but it's an equity issue too. I mean, you can't just not include certain people. I mean, that's universal health care is universal health care. It's for everybody.
Yeah, and I want to add on to that, Virginia, because I know that this comes up in our meetings too, that because there's such a huge military population, especially down here in El Paso County and Colorado Springs, that they have a lot of great long-term care issues because they are on a similar what universal health care could look like. And so their fears of wanting to like really understand what they might be giving up for that change as well. And so I think down in the southern region of the state, that's definitely a big part of the conversation because we're just so military heavy.
Yeah, absolutely. But that would be a huge question. How does that impact my military benefits? Yeah.
The advantage to that, though, is that they are used to having a single payer kind of system. So that part of it would be, kind of an easier sell. Yeah, I don't have to, they know what it's like to be a more simple system where you don't have to each year, see which drug plan is cheaper for your pills and various.
Yeah,
And
I mean, again,
that's a good point.
Yeah, I think their fear is they'd lose something.
Mhm. I think it also helps for them, like, to tell them that it expands their network in ways that they don't recognize, because I work with a lot of military service members and their spouses, and the reason I see them is because there's no providers available to them on post, right? And now we're going through this really big headache that's about to happen at the first of the year, where TRICARE is now getting merged with TriWest, so another privatized system wanting to take everything all over. And come January 1st, it's going to impact like everyone who's a provider for TRICARE and all their members, because if that's not set up correctly, and of course they're not streamlined, there's going to be huge pauses in insurance. I'm literally working on letters through this weekend to send all my clients, like, please try to see your PCM and put them or get them to put in behavioral health referrals, because active duty members are required to do that. Their spouses aren't. So they've been able to just see me because they can have choice, but that's going to impact them as well. And so that's a really big piece to think of, as like, how is that going to also give them more options, because they don't have to wait in this long list or get told. Or I've had military members prefer seeing me over the years because I've been consistent. Active duty military providers are in and out of that system quite a bit. Confidentiality and consent looks a little bit different, so people have a lot of concerns with that when it talks about their own disability access or when they need to file for things at the end of their military career. And so that's another big piece, I think, push for military members, is that we can get more access and provider choice than they even kind of get within the system that they have.
Well, thank you for that. That was an aspect I hadn't
I didn't
considered.
know that either. That's a whole big thing. Yeah. Yeah. So when you talk about long-term supports and services, you're talking about folks like disabled or other types of folks that have lifetime care needs. That's the category you're
Yes,
talking
but also including just senior care, for.
That's what I was wondering if you were,
Mhm.
so when you first said it, I have two parents that are in assisted living. And so that was my first thought, is that you meant that kind of care. That's going to be, I don't know that we want to crack that nut under this bill, but to me, that's another one of my big worries, is that, boomers haven't fully even hit assisted living yet. So we have a big hump, and that stuff is expensive. It's scary expensive. So yeah, I don't know where that comes into play with this, but it's going to be a whole thing too.
Well, when we talk to the folks in the Colorado Public School of Public Health, one of the things that they resisted on doing this is that there's a lot of data about what it costs for care, through Medicaid, because of course, a lot of people in nursing homes and so forth are on Medicaid, but there's a lot of unpaid care, like, caring for your parents in your home or whatever, or home health and that sort of thing. And so it's to take a look at that. And one of the reasons they resisted is because what they said is the cost for all of that is going to be eye-popping. But we want to know if it's possible or not. And if it's a bridge too far, it's a bridge too far. But we can't ignore that is something that everybody worries about. And the way we do it now is that you basically have to be impoverished before you can get Medicaid and get any help. And it's not, seems kind of un-American.
All too familiar. My parents are in that phase of life, and luckily, they were lucky enough to get long-term health insurance when it was gettable for a decent price, when insurance companies hadn't figured out how expensive it was going to be. And they've been losing on those policies, so they're shutting that sort of thing down. So it's kind of, I think it is going to be eye-popping, and that's a huge concern that I have. But it's probably a different nut that we want to crack in a different, under a different umbrella, perhaps.
Well, that's what we'll find out from this analysis. I mean, we have all of these questions, and they're big questions. Some of them are small questions about, what's going to happen to me. But some of them are big questions about, whole classes of people. And so we really need to study it in a systematic way. And in, the best of all worlds, this would give us some information that shows that, well, yes, indeed, Colorado could do a state-based universal health care system after getting the federal waivers and all that jazz. And so it's doable. So let's have a referred ballot measure, or let's have a citizens initiative if we can't get a referred ballot measure through the legislature. But that's, after the study. None of that's possible unless we get this analysis done. So
Understood.
we're very careful when we talk to legislators such as yourself and others who may be more skeptical or not as motivated as you, is that this is information that we need to see if it's possible to do better, because we know that what we have now is horrible. It's unsustainable. And I would argue that it's one of the things that, there's so much anger in our politics these days between the haves and the have-nots. And I would posit that the terrible state of healthcare, or not healthcare, but health insurance, is part of that anger.
Absolutely.
If you feel like
somebody got shot this last week,
yeah,
it's only going to get worse, right?
yeah, and people live in fear of medical debt. People would
Rightly
rather
so.
die than impoverish their family.
Yeah.
People are afraid to go to the doctor. It's difficult enough if you take out the money proposition to get people to go and take care of themselves because they're afraid of what they're going to find out.
Right. Right.
But when you throw in the money situation, it's just awful. And there are just countless stories of, like Cathy mentioned, of people not going to the doctor when they should, with dire consequences.
Yeah.
Could one of you, Virginia, you just mentioned the federal waiver. And can you or Cathy or somebody expand on that? Because that was Lindsay Doherty's concern when she was a House rep, and we first had a conversation with her. And just the word federal, makes your blood run cold, especially with the new administration coming in.
Well, the Affordable Care Act allows that if a state can come up with a way to do health care and cover as many people and not cost any more, that you can get a federal waiver, which would mean that the money that's flowing into our state already for Medicare and Medicaid would go into this program. So to be part of the funding, because you may or may not realize that government pays for 60% of healthcare already. And so, but it's just fragmented in all these different ways. So if you can get federal waivers to have those funds flow into what we would have as a state enterprise to help fund, of course, that will be important. And with a friendly administration, you could be probably assured that you would get those waivers. And of course, now, we have no idea what to expect from this administration, except that they're not going to cooperate with, let's just say their funders are really happy with the status quo, and in fact, they're going to accelerate privatization of Medicare through Medicare Disadvantage. But we believe that we need to move forward with what we're doing so that we will be ready when the time comes when it is possible to get waivers. Because frankly, I feel this administration is going to get a huge rebuke in 2026 and in 2028 even more. And so this actual analysis wouldn't be finished. It would start in summer of 2025 and hopefully be done in 2026. And then we would need time to figure out, well, what's the next step? What are we going to do? And so these things will take time. Plus, there needs to be a huge education campaign to the people of Colorado, as well as the electeds, of, this is what we could do. I mean, look at this analysis. This is what we could do. So let's figure out how to do it. I mean, that doesn't happen overnight. So that's the best case scenario.
Yeah, I think messaging is going to be so important here. People don't realize a lot of what we've discussed here. And to your point, it's going to take time to get the information together. So hopefully, I mean, I hate to say this, but hopefully the Trump administration does the work for us to make the electorate excited about kicking them out in 4 years.
Mm-hmm.
Yeah, two things. One is about privatization, and it is so not good for something that's a public good. And we're seeing that with doctors practices. And I've seen things on Facebook as far as, my doctor is seeing me for 15 minutes, and that's all I can do, because they were taken over by this, a company, and they don't care about, they just care about the bottom line. And it's affordable housing. It's, there's other areas where privatization is just not sustainable. So that's one piece. And then your thing about messaging, we do have a coalition or alliance of a number of groups that are either working directly for healthcare reform, like, Healthcare for All Colorado Foundation for Universal Healthcare. And there are also a whole bunch of other organizations that are with us, as far as, that's a part of their, that there's a part of their, they're trying to help people in a lot of different, here it is. Okay. So things like Colorado Children's Campaigns, Colorado Academy of Family Physicians, Arvadans for Progressive Action, we have a different teams. The PTA of Colorado. I mean, there's so many groups that this would be a part of what, we're stronger together and unified. And we're still working on, this is the sheet with all the emblems of the different organizations. And there's more than these. This was just from like April of this year. So that's, but messaging is hugely important. And I really, we need, and the alliance, we meet at least once a week, and these groups getting together and trying to share information. And that's how we got Dr. Lee to come with us today, because I was saying we had this meeting and now we're not having it, but Amy's coming. So do we know anybody that in your constituent that's interested in your in the healthcare? And so here you are. So that's kind of an example of how we spread the information to different parts of Colorado. And there's the rural and the rural hospitals closing. I mean, there's some regional things that are specific, but the bottom line is that there's the 10 essentials was the other thing, and I can send you a copy of that. But
that would be great.
That was how the School of Public Health came up with this. The foundation was based on these 10 essentials, which just a couple of them. Provides comprehensive benefits for medical care, including dental, hearing, vision, and mental health. Funded by premiums based on ability to pay. Prohibits deductibles and co-payments, which kills people, in a lot of places. And that's like, I have to pay this much, so I'm not going to go see the doctor kind of idea.
Getting higher and higher to the point where, we're almost to the point where we have, and for some people it's just catastrophic care. I mean, you're out for everything. Plus, you still have to do all the red tape, so you get credit for your out of pocket on top of that.
Okay, I'm going to send you a copy of the 10 essentials. And so you can, that's something we're still working on. What's the a slogan kind of thing. I'm not sure if we, have but there's a couple of speakers from our groups that talk about fraud, misuse, and abuse by the system, people by the system. And and providers are leaving and they're retiring because they can't deal with all this red tape and all these different multi-payer provider requirements. I just got approved to be on Medicaid, and I didn't realize, but there's all these regions of Medicaid. So I filled out one application for the state, and then this one region wants me to fill out this other huge, and I'm a provider, and it's like, let's make it easy, because I think we do have a shortage of people in mental health, medical doctors, pharmacists, because we have all these middle people that don't add anything to people's health. And so, that's another, we could kind of go on and on for days on this. But we won't.
Me, like Peter mentioned too about
Okay.
Sorry, I didn't realize you were still talking.
Anybody, we have 5 more minutes. If anybody has, some things to add here.
Yeah, Amy, I was going to say too, I am down here in Colorado Springs. Ironically enough, you actually knocked on my door one day during your campaign, but I was in the middle of a session, but I saw you on my Ring camera, which I appreciate, like actually being out and doing the good work. But myself and another member of the Colorado Foundation for Universal Healthcare lived out in the Springs. So if you ever wanted to like set up time with us to chat more about these things or other community events or, messaging for other people, we're absolutely open to doing some of those things for sure.
Yeah, that would be great. If you could, do we have a chat on here?
I do see it. Yeah.
Send me your contact info in the chat and I'll grab it up, or I can give you mine, whatever works.
I'll send it over. Yeah.
Okay.
If I could add a little something too, Cathy. The group that we all belong to is there are like half a dozen different organizations, like Cathy's Arvadans for Progressive Action, and so are Pat and Joyce. And Lee and I are with Colorado Foundation for Universal Healthcare, and there are several other organizations, and we've come together to form an alliance to work on this together. And we have what we call a legislative action group, which is a meeting that I lead, which works just on this piece of legislation. And then we have a big picture group, which is considering things like messaging and fundraising and a strategic plan for how we're going to achieve our goals beyond this piece of legislation. So we are working very hard. We've been meeting basically every week for 18 months, working on this together. And of course, now we're all excited to, and actually we waited until after the election to decide whether we were going to run this piece of legislation again. And frankly, when I came to that meeting right after the election, I was ready to hear people say, oh, we got no shot. Let's not, it's too much work. We can't do it. But people were enthusiastic and want to run this bill again. And I think it's what you hear over, all throughout the country is, don't just back off and disengage and go for a cruise and ignore everything that's going on and try to insulate yourself from the chaos, but stay involved, stay working on what you're working on, keep working, and don't give up. So that's what we're doing.
Excellent. So I will get with Reps McCormick and Basenecker and get, ramped up with them and see what I can do for them. So my question is there anything else I can do for you?
When we have a legislator action day, that's usually like February, March. If we can see, stop in and see you, that would be great.
Sure. Yeah.
And
Don't have an office yet, but I will.
I know that's a thing that's going to happen for sure. Anybody else have any?
Yes, one more thing is I hope when you talk to Representative Basenecker and McCormick that you will be a co-sponsor right off the bat. We feel like we waited last 2 times until third reading to pick up additional co-sponsors, but I understand that it's possible to become a co-sponsor right off the bat when the bill is introduced. So if you could work with them to do that, that would be wonderful. And of course, I know that you need to see the new draft of the bill and to just in terms of the language change that we will have is basically to reflect that we plan to do the fundraising. And so that's the main thing that's different from the copy of the bill that you could see now.
Okay. Yeah. And that'll be huge, as you say, because otherwise it's just going to get stuck in appropriations and die again.
And abortion is healthcare also. So if people are, supporting the right to women's right to choose, then of course this goes along with it. That's we actually sat down with Cobalt and some of the other abortion organizations, and they are part of they are supporting us and we're supporting them. And so when we are unified like that, we get things done.
Mm-hmm.
So
Yeah.
Thank you for coming, for listening, for being a part of our meeting. And
Absolutely. I mean, like I said, this is where it started for me. So I mean, I've got all kinds of other plate spinning that I'm, interested in, but this is so important and it impacts so much. People are very concerned right now about affordability. Well, hello, let's pay for this in a way that is not 10 times more than it needs to be.
And by having it make so much more other systemic issues more accessible or affordable because you're not in debt or spending all your money on that. You can afford your home or afford your groceries or
Exactly. It
like
all
what
goes to the
you have
same.
universal health care.
Yeah. Yep. I agree.
everybody needs it at one time or another.
Mhm.
Absolutely. If you don't need it now, you'll need it later. You never know when you're going to get hit by a car, and you're going to get old. If you survive, you're going to get old.
Yeah.
So, and that's going to cost money.
Yeah.
That's true. Well, thanks, you guys. Have a wonderful rest of your day, and hopefully we'll be down at the Capitol sometime in the next few months.
Okay, sounds great. Thank you so much for including
Hey,
me.
guys.
Thank
Thanks,
you.
Cathy. Thanks, Amy.
Hey,
Great to meet you.
Cathy. Thanks, everyone.
Okay, bye-bye.
Bye. And the meeting. That's